Impact on relationships and family dynamics. Navigating the effects of infertility on couples and family structures. Infertility can have a profound impact on relationships, family dynamics, and personal well-being. The emotional, physical, and financial toll of infertility treatments can create strain on romantic relationships, relationships with family members, and even social networks. Understanding and navigating these effects is crucial for fertility care providers to offer holistic, patient-centered care. This includes addressing the unique challenges faced by couples and families and offering support that takes these dynamics into account. 1. Emotional impact of infertility on couples. A. Grief and loss. Infertility often brings about feelings of grief and loss, which can be experienced by both partners. The loss of the possibility of having biological children or the uncertainty of the fertility journey can trigger sadness, disappointment, and sometimes even a sense of failure. Couples may feel isolated or misunderstood by those who do not face similar struggles, and the grieving process can be prolonged with each failed cycle or treatment. B. Stress and anxiety. Infertility treatments can create significant stress. The uncertainty of treatment success, the emotional and physical toll of medical procedures, and the financial burden can increase anxiety levels. Couples may feel anxious about their future together and whether their dream of parenthood will ever be realized. C. Emotional disconnect. The emotional roller coaster of infertility treatments can lead to an emotional disconnect between partners. One partner may be more involved or invested in the process, leading to feelings of misunderstanding or resentment. If communication is not maintained, this disconnect can strain the relationship and cause further emotional distance. D. Gendered experiences of infertility. Infertility is often viewed through a gendered lens. While both partners are involved in the fertility process, women may feel the brunt of the emotional and physical toll due to hormonal treatments, invasive procedures, and societal expectations regarding motherhood. Men may experience frustration, feelings of inadequacy, and emotional stress, but often face societal pressure to suppress these emotions. 2. Effects on relationship dynamics. A. Relationship strain. The shared struggle of infertility can either strengthen a relationship or expose existing vulnerabilities. Stress from infertility can magnify previous issues or lead to new problems, such as differing views on treatment or the desire for children. Communication is key in preserving the relationship through infertility. Couples who struggle to communicate openly about their emotions, fears, and desires may face greater emotional strain. B. Coping strategies and support. Coping strategies play a significant role in how couples handle infertility. Some couples may use shared coping mechanisms like attending counseling together, engaging in relaxation exercises, or simply leaning on each other for emotional support. Couples counseling is a valuable resource for fertility patients as it helps partners navigate the emotional strain, foster healthy communication, and provide strategies to cope with the stress of infertility. C. Impact on sexual intimacy. The focus on conception and fertility treatments can affect sexual intimacy between partners. Couples may feel that sex has become purely functional or clinical rather than an expression of affection or desire. Sexual dysfunction may also arise due to the stress of infertility, side effects of medications, or feelings of inadequacy. Maintaining intimacy outside of reproduction is an essential part of preserving a couple's relationship. 3. Extended family dynamics and reactions. A. Family pressure. Extended families can play a significant role in a couple's fertility journey. Family members may impose emotional pressure, either intentionally or unintentionally, by making comments about childbearing, or by expressing concern over the couple's delay in having children. In some cultures, the expectation to have children is particularly strong, and couples may feel ashamed or guilty when they face infertility, adding more stress to an already difficult process. B. Unsolicited advice. Family members often offer unsolicited advice or suggestions on how to conceive, which can lead to frustration. This advice might be well-intentioned, but can undermine a couple's emotional stability and sense of control over their fertility journey. Infertility patients may also feel judged or alienated by family members who have children or who do not understand the emotional toll of the process. C. Impact on relationships with parents. Parents' expectations regarding grandchildren may create additional pressure. For example, the pressure from a mother or father to become a parent can heighten a couple's stress and feelings of inadequacy. If either partner's parents are not supportive, it can lead to feelings of isolation and distance between the couple and their families. 4. Impact on social relationships and support systems. A. Social isolation. Infertility can lead to social isolation, as couples may avoid social situations involving children, or they may be hesitant to share their experiences with friends who have children. The emotional toll of infertility can make it difficult for couples to relate to others in the social circle. Support groups and counseling services can help couples connect with others facing similar experiences and reduce feelings of isolation. B. Navigating relationships with friends. Couples dealing with infertility may find it challenging to maintain relationships with friends who have children or who are starting families. They may avoid gatherings or feel disconnected from their peers. On the other hand, friends can also be a source of support by offering empathy, understanding, and a safe space to discuss the challenges of infertility. 5. Family building beyond infertility. A. Adoption. Adoption may be a viable option for couples facing infertility, but the decision to pursue adoption can be challenging. The emotional journey of adoption may mirror some aspects of infertility, including a desire for biological connection, waiting periods, and an often long and complex process. Family dynamics may shift as a result of adoption, especially in relation to cultural or personal views on adopting children from different backgrounds or ethnicities. B. Surrogacy and egg/sperm donation. For couples considering surrogacy or egg-sperm donation, these options can create emotional and ethical challenges related to parental identity, biological connection, and societal acceptance. The decision to use a surrogate or donor gamete can affect relationships, not only within the couple but also with extended families and society. These choices often require careful emotional processing and open communication. C. Accepting a child-free life. For some couples, the decision to stop fertility treatments and live a child-free life is a significant shift in their family-building vision. This decision can be empowering, but it may also require grieving the loss of the dream of biological children. Couples may experience mixed emotions, including sadness and relief, as they navigate this new phase of their relationship and life plan. 6. Psychological and emotional support for couples. A. Couples counseling. Couples counseling provides a space for partners to express their fears, concerns, and emotions about infertility and its impact on their relationship. Therapy can help couples work through feelings of loss, frustration, and helplessness, while also offering techniques for improving communication and emotional support. B. Fertility counseling. Fertility counseling helps couples manage the emotional challenges associated with fertility treatments, including stress management, expectation setting, and the psychological effects of treatment cycles. Fertility counselors can help patients process grief, manage the emotional ups and downs of treatment, and navigate difficult decisions, such as discontinuing treatment or choosing alternative paths to parenthood. 7. Conclusion. Infertility has far-reaching effects on relationships, family structures, and social dynamics. The emotional burden of infertility can strengthen relationships when couples work together, communicate openly, and seek support. However, without proper care, infertility can also lead to relationship strain, emotional disconnect, and isolation. Providing holistic fertility care that includes psychological support, counseling, and respect for each couple's unique dynamics is critical in helping them navigate the effects of infertility and family building. Understanding and addressing the emotional and relational aspects of infertility ultimately fosters better treatment outcomes, improves well-being, and strengthens relationships.